Hello, my name is Chloe Knox, and in this video I will be demonstrating a vertical drop jump test, which is a functional movement assessment used to evaluate an athlete's ability to control lower limb mechanics during a landing or drop from a specific height. This test is commonly used to identify potential movement patterns associated with increased injury risk, such as knee valgus. A study conducted in 2005 from the American Journal of Sports Medicine found that the knee abduction angle coupled with femoral adduction was 8 degrees greater in anterior cruciate ligament-injured than in uninjured athletes. Concluding the study, the authors found that the knee motion during a landing task is a predictor of anterior cruciate ligament injury risk in female athletes. Considering that this study was assessed only on female athletes, it is a limitation due to the fact that we cannot assume the same results on males. For this variation of the vertical drop jump test, a platform of about 31 centimeters off the ground will be needed. This test uses the validated mobile application MyJump2 in order to identify any knee valgus. This information is then used to identify weaknesses in muscle groups or the biomechanics of the athlete in order to construct an individualized training program. It is crucial that the athlete is aware of what is being assessed to account for the athlete's neuromuscular control and capability of certain movements during the test. Always ensure the athlete performs a proper warm-up to prepare. Keep the platform or box on a flat surface and mark a designated landing zone to ensure consistent foot placement during the test. Instruct the athlete to step off the platform and perform a controlled drop, landing with both feet in the designated landing zone. Emphasize the importance of absorbing the landing forces through a controlled bend in the knees and avoiding any excessive inward collapse of the knees, in other words, knee valgus. MyJump2 generates reference points on different joints of the athlete, being the hips, knees, and ankles, in order to assess knee valgus. The app calculates the degree of knee valgus based on the angles and movements of these reference points. Therefore, the administrator must remain in the same location during all 3 trials, and that location must be directly anterior to the athlete at an angle of about 180 degrees. Common error can occur if the administrator moves the camera from this angle or the athlete being assessed ignores the foot placement markers. This would cause the data from the reference points to be assessed from a different angle, which would ultimately decrease the reliability of the test. Looking at the results from the study, the peak contact point within the drop jump assessed ACL injured athletes as having an average angle of 9 degrees of tibial abduction coupled with femoral adduction. Comparing these results to the data assessed in the test I administered, we can see that this participant has a bilateral asymmetry of dynamic knee valgus between his right and left side, which could potentially be concerning. The participant also gathered an angle of 7.5 degrees of knee valgus, which is not too far off of the 9 degrees of tibial abduction, which was accounted for in the ACL injured athletes. The largest average valgus occurred within the 3rd trial completed by the participant, and the last 2 trials seem to have a larger average valgus than the first 2 trials. This information could possibly support the argument that fatigue may worsen knee valgus. The data gathered is not indicative of a major issue, although it should still alter training decisions, especially in soccer players. The bilateral asymmetry needs to be addressed through unilateral tests and strengthening exercises. It should also be advised for the athlete to strengthen muscle groups such as the gluteus medius, hip external rotators, quadriceps, and hamstrings. Staying conscious of proper landing and deceleration technique is crucial to preventing injury. There are some adjustments which should be taken into account for the next administered assessment. It is important to note that the study was centered around the findings of female athletes, and the data should not be directly applied to male athletes. Standardizing the distance between the feet is also crucial to the findings of the test. Within the study, the participants stood with their feet 35 centimeters apart and dropped from a platform at a height of 31 centimeters. The platform used in this assessment was about 42 centimeters. Within the study, participants also used their arms to load their jump height before landing. In this assessment, the participant completed his jump with the hands remaining on the hips. Had the details of foot distance, platform height, and load amount been more exact, then the results of this assessment would be more consistent toward the results of the study.